The tragic death of Nex Benedict, a 16-year-old transgender student of indigenous heritage from Oklahoma who used he, him, they, and them pronouns has garnered national attention. Nex was bullied shortly before death, which has been ruled a suicide. The chief medical examiner attributed Benedict's death to toxicity from diphenhydramine, Benadryl, and fluoxetine, Prozac, in a brief report. The horrific physical assault is not mentioned in the brief autopsy report. High levels of diphenhydramine have unfortunately been seen in teenagers recently due to the TikTok Benadryl challenge. Depending on dosage, overdoses may be inevitable, but in other cases, drug interactions could be the tipping point in overdoses. Fluoxetine can block an enzyme in the liver, specifically CYP2D6. Those kind of enzymes, called P450 enzymes, help detoxify substances absorbed by gut, including medications. Benadryl can block that enzyme to some extent too. In other words, they both compete for that enzyme, which helps chemically alter the drugs. When two drugs compete for the same enzyme, drug levels of both build up. This is called competitive inhibition. CYP2D6 is a so-called cytochrome P450 enzyme. These enzymes help to detoxify substances taken in by the body, including medications. Prozac may have further elevated Nex's already high levels of diphenhydramine, although taking a large amount of a medication seems to be what happened here. This case is an opportunity to remind people to tell all healthcare prescribers about all the medications they are taking so as to catch drug interactions. Prozac can also cause cardiac rhythm abnormalities. Specifically, it can cause QT-prolonging, which refers to changes in the electrical rhythm in the heart. This can lead to a kind of short circuit called torsade de pointe, which can be fatal. Some people have an EKG that shows QT prolongation at baseline. They are more prone to torsades and have to be extra careful about medications taken. The best source for which drugs are riskiest is crediblемeds.org. For fluoxetine, they rate it as having a conditional risk, generally safe except in special circumstances, including, for example, high ingestions of drugs or similarly drug interactions to boost drug levels. Not all drug interactions can be caught by pharmacists, etc., if herbal remedies are not listed along with pharmaceuticals. The herbal substance Kratom, for example, can significantly affect the 2D6 enzyme involved in fluoxetine and Benadryl. It should be stated, however, that Nex Benedict did not take any recreational drugs or herbs according to his family. WebMD and Medscape list the diphenhydramine and fluoxetine combination as a minor drug interaction, and Kratom cannot be added. DrugBank lists the interaction as having moderate significance, but doesn't allow Kratom to be added. Takeaways. 1. Teenage challenges on TikTok and other social media can be dangerous, at least for some kids, who have no idea of the risk they are running. 2. Benadryl can be dangerous in high amounts. It may be wise to limit how much is available to impulsive teens, particularly teens on prescription meds. 3. Different drug interaction checkers may give slightly different results. Most drug interactions are not of major importance. Getting a perspective from providers and pharmacists is recommended, and drug overdoses is a far different situation than taking prescribed amounts. 4. Drugs can interact with herbs as well. Kratom, for example, can inhibit CYP2D6. 5. When people take more drugs and herbs, there is the potential to create more drug interaction pairs. Pairs of drug interactions are relatively easy to predict, but for more complex interactions, predictions can be difficult and potentially of very high magnitude.